There is a document, a real one, prepared for the United States Defense Intelligence Agency, declassified and released to the public through a Freedom of Information Act request. It is not a conspiracy theory. It is not a leaked rumor. It is an official government report, and its title alone should make you stop. It is called Anomalous, Acute, and Subacute Field Effects on Human and Biological Tissues. And what it documents, in clinical, precise, bureaucratic language, is what happens to human beings who get too close to unidentified aerial vehicles. Radiation burns, brain damage, nerve damage, heart palpitations, paralysis. The report does not speculate about whether these injuries occurred. It states that sufficient incidents have been accurately reported and medical data acquired to support a hypothesis that some advanced systems are already deployed. That is the United States government, in its own words, in its own document, acknowledging that people have been physically injured by encounters with unidentified craft, and almost nobody knows this document exists. Stay with me, because what follows is not theory. It is documented, medically verified, officially investigated, and in most cases still completely unexplained. To understand the full weight of what that Pentagon document represents, you need to understand the categories it describes. Researchers who have spent decades cataloging reported UFO encounters have organized human injuries into a specific taxonomy. The first category covers temporary effects, paralysis, dizziness, nausea so severe it requires hospitalization, a tingling sensation across the skin, sensations of electric shock without any electrical source present, a feeling of intense heat radiating from outside the body, temporary blindness lasting hours, mild burns appearing on skin that was covered by clothing, unusual sounds and smells with no identifiable origin. These are the mild cases, the ones that resolve and leave the person shaken but physically intact. The second category is where things become significantly more disturbing. Severe burns, scarring that persists for years. Open sores that appear, heal, and return in patterns that doctors cannot explain through any known mechanism. Cancers developing in people with no prior risk factors, following timelines that align precisely with their reported exposure. Anemia, blood cell abnormalities, the kind of systemic damage that radiologists recognize immediately when they see it in patients who have been near nuclear facilities or medical radiation equipment, but that makes no sense when it appears in someone who is simply standing in a field. These are not isolated claims from unreliable witnesses. These are medical records, hospital admissions, lab results, blood tests, physical examinations conducted by doctors who had no stake in the outcome and no reason to fabricate findings. Now take all of that clinical framework and put a human face on it. On May 20, 1967, a man named Stephen Michalak drove out to the wilderness near Falcon Lake in Manitoba, Canada, to do what he did most weekends: prospect for quartz and minerals in the Whiteshell area. He was a skilled industrial mechanic, a former military policeman in Poland, and by every account a methodical, detail-oriented person who did not have a reputation for exaggeration. What he encountered that day became the most physically documented UFO case in Canadian history, and one of the most thoroughly investigated close encounter cases anywhere in the world. Michalak reported that two disc-shaped glowing objects descended near him, one landing on a flat rock surface while the other hovered and then departed. He approached the landed craft, heard voices he could not understand coming from inside it, and attempted to communicate in several languages without response. Then the craft rotated slightly, and a grid-patterned exhaust vent on its surface moved to face directly toward him. A blast of hot gas hit him square in the chest. What followed was not a story. It was a medical record. Michalak lost 13 pounds in 3 days from severe nausea and vomiting. Over the following weeks, he lost a total of 22 pounds. His white blood cell count dropped sharply, a pattern physicians associate specifically with radiation exposure because radiation disrupts the bone marrow that produces white blood cells. He experienced recurring blackouts. He developed burns on his chest and abdomen in a precise geometric grid pattern that exactly matched the configuration of the vent he had described seeing on the craft. A United States radiologist who reviewed his case estimated he had received somewhere between 100 and 200 rentgens of radiation, a dose significant enough that the radiologist noted it likely lasted only seconds, because any longer exposure at that level would have been fatal. Soil samples taken from the landing site tested positive for radioactivity. His clothing tested positive for radioactivity. Investigators found a 15-foot semicircular area at the site where vegetation had been burned away. The Canadian Royal Mounted Police investigated. The Royal Canadian Air Force investigated. Michalak was evaluated at the Mayo Clinic in Rochester, Minnesota, one of the most respected medical institutions in the world, where a psychiatrist concluded he was, in their words, very pragmatic, down to earth, and does not make up stories. And then, most strangely of all, the burns on his chest returned, not once, but repeatedly, on a cycle, appearing in the same grid pattern at intervals of exactly 112 days, for years afterward. No physician who examined Michalak was able to explain the recurring cycle. The case remains, to this day, officially unexplained by every Canadian and American government body that investigated it. But as disturbing as the Falcon Lake case is, it involves one person who walked toward something willingly, however unknowingly. What happened on the evening of December 29, 1980, on a rural highway in Texas, involved people who had no choice about what they were exposed to. Betty Cash, 51 years old, was driving with her friend Vicki Landrum and Vicki's 7-year-old grandson, Colby, when they encountered a large diamond-shaped object blocking the road ahead of them. The craft was emitting intense heat, jets of flame from its underside, and a brightness that made the night sky look like daylight around it. Betty stepped out of the car. She stood closest to it for several minutes before the object finally moved away, accompanied by what witnesses described as dozens of military helicopters surrounding it. The drive home that night was the last normal thing that happened to any of them for a very long time. Within hours, Betty Cash's skin began to blister. Her head swelled, clumps of her hair came out in her hands. She was vomiting continuously. Her eyes swelled shut. When she arrived at a hospital, doctors were confronted with injuries they could document but not diagnose. Her blood cell counts were abnormal in patterns consistent with radiation exposure. She had what physicians described as radiation-like burns across her face and scalp. Over the following years, Betty underwent multiple hospitalizations, lost the ability to care for herself during extended periods, and eventually developed cancer, requiring surgery. Vicki Landrum experienced hair loss, skin damage, and chronic vision problems. Young Colby, despite being inside the car for most of the encounter, still suffered skin irritation and eye problems that required medical attention. None of them were ever given a diagnosis that adequately explained their symptoms. None of their doctors could identify what had caused the specific combination of injuries they presented with. In 1983, Betty and Vicki filed a lawsuit against the United States government, seeking $20 million in damages on the grounds that the object they encountered was a classified American military craft. The lawsuit was dismissed, officially on the grounds that no identified United States aircraft matched the description of what they had seen. But investigators who reviewed the case noted that the military records examined during the proceedings specifically excluded classified aircraft programs, meaning the investigation was built on a foundation that was, by design, incomplete. The Pentagon document released through the Freedom of Information Act connects these cases to a broader scientific framework that makes the injuries more understandable, even if it makes the encounters themselves more alarming. The report specifically links the observed injuries to what it describes as energy-related propulsion systems. The technical language the document uses points toward electromagnetic radiation in the millimeter wave range, frequencies between 30 and 300 gigahertz, as a likely mechanism for many of the burns and tissue damage reported in close encounters. This is not exotic physics. This is the same frequency range used by a weapons system the United States military openly acknowledges developing and deploying, called the active denial system, sometimes referred to informally as a heat ray. The active denial system works by directing millimeter wave energy at a human target, causing an immediate, intense burning sensation on the skin that forces the target to move away. At lower power levels, it is designed as a non-lethal deterrent. At higher power levels or longer exposure times, the same physics that makes it an effective crowd control tool would produce precisely the kind of burns, nerve damage, and tissue injury documented in the Pentagon's own UFO injury database, which raises a question that the document itself does not answer, and that no official investigation has publicly resolved. If the physics of these injuries points toward electromagnetic propulsion systems, and if the U.S. military has been developing technology based on exactly those same physical principles, then what exactly were the people at Falcon Lake and on that Texas highway in 1980 actually exposed to? The honest answer, which is also the most unsettling answer, is that no one with the authority to know has been willing to say on the public record. The Falcon Lake investigation concluded without identifying a source for Michalak's injuries. The Cash-Landrum lawsuit was dismissed without examining the classified aircraft programs that might have provided an explanation. The Pentagon report that catalogs over a century of human injury reports from UFO encounters was prepared for the defense intelligence agency, classified, and only reached the public because of a Freedom of Information request that took years to fulfill. And the injuries keep appearing in the documented record with a consistency that makes coincidence increasingly difficult to argue. The same symptoms, the same patterns, blood abnormalities, neurological effects, recurring in case after case, across decades, across continents, in people who had no connection to each other and no motive to coordinate false claims about injuries that in many cases destroyed their health, their reputations, and their lives. There is a specific phrase buried in that Pentagon document that has stayed with researchers who have read it carefully. Tucked inside the clinical language about electromagnetic frequencies and tissue damage is a statement about the nature of the objects causing these injuries. It notes that the evidence supports a hypothesis that some advanced systems are already deployed, not systems that might exist, not systems being developed, systems already deployed. That phrase was written for the Defense Intelligence Agency of the United States government. It was classified, and it describes the things that put Stefan Michalak in the hospital, that took Betty Cash's health and eventually her life, that left a 7-year-old boy with symptoms his doctors could not explain, as advanced systems, already here, already operating, and the people getting too close to them are paying a price that no official body has ever fully accounted for. The question that document leaves open, and that no government has answered, is this: advanced systems built by whom?